With the new administration's threats towards Medicare and Medicaid, now more than ever, Americans are concerned about their ability to efficiently receive the health care they need. Welcome to another episode of InFocus. I'm your host, Ethan Neir.
It's no controversial statement to say that the United States healthcare system is fundamentally broken, and students at WSIU tend to agree.
Name is Chels.
Hi, I'm Moxie Giedemann.
I'm Gabe Largent.
Name is Darnell.
These companies' choices not to insure them is basically, I think, the most blatant way of saying we don't care about the poor. Sometimes I wonder if it's too broken to be fixed.
This would be some things that should be changed around that. I feel like if you're paying for some services, you should have full clarity and full reinsurance that you will be taken care of.
And I think that the way that the healthcare system runs in the U.S. with profit over people's lives really harms everybody. I still find myself not really wanting to ever go to the ER or the hospital.
We definitely need to make some very apparent changes. We've kind of commoditized necessary things for people.
Over 100 million Americans are in medical debt. 58% of people that have filed for bankruptcy from 2013 to 2016 said healthcare was a great factor. And even anecdotally, nearly everyone is or has someone close to them that has been affected by high medical payments. And it's not a problem that's been getting any better. Since 2000, healthcare costs in the United States have tripled. So, what is the solution? In a post-COVID world where healthcare concerns become more and more real for more and more people, what is the catalyst for change for the everyday American? Well, that is part of the problem. There hasn't been much of a pressure valve release. Neither of the two major political parties have rung strongly on healthcare reform other than tinkering at the edges, and the public option in the Affordable Care Act, while a helpful tool, only does so much.
To talk about the current state of the American healthcare insurance system, we had the chance to sit down with Dr. Jeff Ripperda of Shawnee Health in Murfreesboro. Take a look.
With WSIU, I am Ethan Neir, sitting down with Dr. Ripperda. Doctor, thank you for taking the time today.
Hey, always happy to talk.
So what was your initial reaction to the murder of United Healthcare CEO Brian Thompson?
I mean, like most of us, always shocked when somebody gets murdered in cold blood in the street for, just about any kind of reason. But I think it definitely points to some underlying currents of general frustration and anger with kind of insurance companies and maybe with the sort of the processes and the healthcare system in general in the United States.
Now, you spoke a little bit to the anger that some people felt, and that seemed to be mimicked, especially in the online reaction. Do you think that sort of matches the feeling of the average American, that feeling of frustration?
Yeah, I doubt you're going to find somebody in America who has dealt with the healthcare system and hasn't had at least some experience with their care being either delayed or put off to some degree because of decisions that are made by insurance companies, whether that be a private insurance company, whether it be Medicaid, whether it be Medicare. The harsh truth, right, is that a lot of times people's care gets delayed, probably more so than put off, although at times it can be put off by insurance companies. And when you're talking about your health, that's a big deal. Nobody wants to wait for a bunch of paperwork to go through to see if they have some sort of serious disease, to see if they're healthy, to delay treatment for any kind of thing. So, it's a little bit sad that that's kind of a universal experience in America to have experienced that, but it is. Anybody who's provided healthcare for any period of time will tell you about patients that they've had where they feel like the care was delayed too long because of bureaucracy. And typically when we say bureaucracy, that involves the insurance companies, but sometimes it can involve healthcare systems as well.
There is often a lot of red tape that you have to work through. And as someone who does work hand in hand with those insurance reps, with the health and care industry every single day, what is it like having to be the middleman on top of also trying to do the rest of your job as a doctor, caring for people?
I think that anybody who hasn't worked in healthcare and was sort of popped into a role in healthcare would probably be appalled at how much time, energy, money, man hours are spent in bureaucracy as opposed to patient care. I mean, literally, there are whole industries in the United States that are kind of devoted to the bureaucracy of healthcare. And again, when I say that, I'm talking about licensing, regulations, insurance payments, getting people enrolled in insurance. I mean, it's a more complex system than most of us feel that it needs to be. And insurance companies play a big role in that, but then government regulations play a big role in that. Safety concerns play a big role in that. So we're not a very efficient system. You know, if I was going to criticize the American healthcare system in any way, it's that it's not very efficient. And even though, you know, if you ask people their frustrations, probably most of those frustrations are going to come down to sort of that in general, is that just we don't do a great job at efficiency.
And you were speaking sort of to the complexity of the system, and it probably plays into this next point. How has it been having to view the firsthand responses from patients to whatever the issue may be with insurance?
Yeah, so I mean, like anybody in just about any kind of industry, we get a wide range of responses, of course. People who are sort of deeply enmeshed in the healthcare system because of illness, let's say somebody who has like a really bad lung disease, a really bad heart disease, cancer, they've required multiple surgeries for whatever. For better or worse, you know, a lot of those patients just sort of have to turn off the part of their brain that questions why things take so long or why the system works the way that it does, sort of to protect their mental health. So people who are really enmeshed in it just kind of say, well, that's just the way the system is, and that's the way it's going to be. The most frustration I get are from people who are generally healthy, but then all of a sudden they have a health issue that requires much more frequent contact with the system, and they just haven't quite bought into what the bureaucracies and inefficiencies are around the system. And those people kind of seeing it with fresh eyes are probably the ones who I get the most complaints from, saying, why does this take so long? Why do we do it this way? Why is there so much paperwork? And I mean, to some degree, we doctors, nurse practitioners, PAs, nurses, you know, administration, we all kind of recognize that. But also at the same time, it's not something that you can get angry about every single day, or your mental health will just go to pot.
Yeah. And we have been talking about the inefficiencies that exist within the American healthcare system. And there certainly is a different way of doing things, as we see in a lot of European countries, Scandinavian countries specifically. We see a system of socialized medicine where everybody's covered under a system that is run and organized by the government. In your personal opinion, how possible and how beneficial could a system like that be instead of the system that currently exists?
I mean, so out of the 30 kind of first world countries, or the G30, the biggest economies in the world, where the United States is the only one that doesn't have kind of a single payer government system. So to say that it's impossible to figure out is just not true, because pretty well every other thriving economy in the world has figured out how to make that happen. Now, having said that, right, in those countries, they have generally just as good a health outcomes as we do here in the United States. But they also have lower patient satisfaction scores, and they struggle with some efficiency issues as well. So it's not like it's a panacea or some sort of fix all. They go to a single payer system, but things are much cheaper in those other countries as well. So it seems like the trade-off there is that typically patient satisfaction goes down a little bit. Maybe wait times for certain things go up a little bit, but health outcomes don't really change, and healthcare generally gets cheaper. Now, to switch to something like that would take a massive blow up of the system as we know it. And there are a lot of people in the healthcare system, I mean, physicians and me included, who make very comfortable livings doing what we do. And the thought of switching something like that, you know, would be scary. You know, do I think it's probably a better system in the long run? I mean, most of the data says it probably would be, but getting there would be a pretty big fight. And I'm not sure that there's the political will and probably too much phobia of change to really make that a realistic goal over the next several years anyway.
Yeah. And bringing up the politics aspect, health insurance, something that is so heavily entrenched and heavily tied to American politics. And a very big deal was made during the last administration of Biden negotiating down the prices of 5 drugs. I believe one of them being insulin was the main one that they were talking about. How do you view the negotiations that happen? How do you view the drug prices that exist right now? And is that something that we need to be looking at more?
I mean, pharmaceutical pricing in the United States is kind of bonkers. I mean, it's almost incomprehensible. I mean, we put a lot of regulations on drugs, so they have to be studied a ton before they're allowed to hit the market. So if a new medication is developed, it's not like it gets developed and it hits the market. It takes years of study to prove that the medication is safe and effective. And companies are spending millions and sometimes billions of dollars to prove that just one medication is effective. And they're also going to have many failures where they spend millions of dollars on a medication that doesn't meet the threshold for being considered safe and effective. So, and I mean, pharmaceutical companies are generally operating under a capitalistic model, right, where their goal is to maximize profits. Now, the people working there, of course, it's a great honor if you come up with a drug that is a major advancement on previous medications that exist. So I don't want to make it sound like there's not some very good altruistic people working in that industry. But in the end, profits sort of drive what they can do and what they can't do. But then there's all these different regulations around the world, meaning that a drug company might be able to sell a drug for 10 times more in the United States than they can sell it for in Canada. So maybe they'll make almost no money selling it in Canada. So they have to kind of recoup those costs by charging a little bit more in the United States or in Europe or around the world. The way our system is set up, drugs almost always wind up being more expensive in the United States than they do around the world.
Yeah. And because of those prices sometimes being so much dramatically cheaper in neighboring countries, sometimes we have seen cases where Americans will either go across the border, whether it be to Canada or Mexico, to receive care or to try to bring back medication just because it's so much cheaper in Canada or Mexico. And how do you feel about some Americans feeling the necessity to have to do that?
Yeah, I mean, I get the frustration with just about everything that I've said in this interview, right? You're dealing with this sometimes, and I mean, let me start by saying, I guess, well, it's more personal to somebody than their health, or when you or a loved one has an illness. You know, there's nothing more personal than that. But then, to some degree, the system can be very impersonal. It can be expensive. It can be inefficient, and wait times can be long. So, you know, even though I went into healthcare to, you know, try to make it more personal. Again, it's sort of in an impersonal system. And I get why anybody who's out there dealing with the system might sometimes get their feelings hurt, get angry, get upset when they say, hey, this is a very personal thing to me, and I feel like I'm being treated impersonally.
Mm-hmm. And I think some of the personal feelings that people hold when having to deal with the healthcare system may be a large reason why we have seen the reaction that we have since the killing of United Healthcare CEO Brian Thompson. Dr. Ripita, thank you so much for your time. I really appreciate it.
You're welcome.
So then the events of December 2024 should come as no surprise. On December 4th, a man walked up to United Healthcare CEO Brian Thompson, shot him 3 times, and disappeared into Central Park. A suspect for the killing would later be named and apprehended in Luigi Mangione, but even in the roughly 5-day interim between the killing and his eventual capture on the 9th, the response from the general public was shocking, to say the least. Over 100,000 people reacted with a laughing emoji on an official United post announcing the death of Thompson. And anywhere you looked on the internet, you saw the scale go from apathy to joy in this man's death. And the polls that have come out since support this as well, as a YouGov poll found that only a slim 51% majority said it was inappropriate to cheer for his killing, while 22% thought it was appropriate and the remaining 28% being unsure. A GoFundMe was even set up to help pay for Luigi's legal fees. Then the question becomes, well, why? What has caused this reaction by the American public? Is there something inherently violent in American culture? Is this a manifestation of people's disdain of the healthcare system? And what does this say for both the future of healthcare in American society, as well as the class consciousness for the average American?
I don't agree with him being killed, because at the end of the day, he is a human being.
It's really weird. It's really weird to see the public response. And I can't say it's not understandable.
I feel like I should say that murder is bad, but also his actions as a healthcare CEO and other healthcare CEOs has harmed and or killed tens to hundreds of thousands of Americans, potentially even millions.
When it comes to the social media and greater public response to both Luigi Mangione and the killing of United Healthcare CEO Brian Thompson, the reaction has been puzzling, to say the least, and the fallout from it is only beginning to be seen. To talk about the fallout, we have with us Dr. Chris Mullins. Mullins is a professor at SIU, author, and associate dean in the College of Health and Human Affairs.
Sciences.
Thank you for taking the time.
Oh, you're welcome. I'm glad to be here.
So what is your initial response to the Luigi Mangione, all of that has been going on?
A lot of interest. Not really surprised. We're America. We have a tradition of folk heroes. I mean, and we're back in a time where there's a lot of economic and social and cultural tumult, which is when people begin to look for people to hold up, whether it's our current president or a assassin of a CEO for a healthcare company. But no, America has a long history of folk heroing criminals, and I think particularly here, because healthcare is the most hated industry in America. Its approval ratings are down there with Congress, which is underwater. So not at all surprised. Sad, I mean, I don't like to see people die. I mean, it was a homicide, and that's not a good thing. But I wasn't surprised, and I'm not surprised at the response either.
Yeah, no one here or anyone else is going to advocate that murder is good. No, of course not. An individual died, that is tragic, but it speaks to larger systematic issues.
Very much so.
And as this is another instance of gun violence specifically, do you think part of the reason for the lack of sensitivity is because of how prevalent not just gun violence, but all types of violence are in the U.S., both in culture and just in existence in life?
Absolutely. America was a nation that was founded on various forms of violence, whether it was the revolutionary violence to establish our country, violence used to discipline in families, if you look back historically, and then even the frontier era of needing violence to survive, whether it's versus animals or whatever. So violence is deeply ingrained in our culture. It is one of our solid cultural norms, and to see it emerge now is not surprising. I mean, crime rates are down, and we had a peak during the pandemic, but we're back down to historic lows. But we still have a culture that's infused with violence. I mean, look at TV. It's easier to get a PG rating for intense violence, but if you show a nipple, you're an R. I mean, we're hung up on sex, but we like violence. That's American culture.
And you were kind of speaking to this with the response initially, but your, in opinion, lack of a shock, I think, is in contrast to most mainstream media outlets that were all blown away that this was the response. And it seems to be mostly along these lines of class. And generally the lack of class consciousness that there has historically been in American society. How would you compare it in the US versus some of our European counterparts?
To be brief, Europe spent centuries, millennia, under authoritarian rule, with kings, everything over the centuries. So they're used to a hierarchical class system. And Europe still today is used to existing within a class system being the major social dividing mechanism, the main social organization mechanism. In America, we have this ideology, Horatian algebra and all that we're a classless society, and it just takes luck, pluck, and hard work, and you can become Bill Gates. Well, we know that's not true. The numbers don't bear that out, but that's the belief, and that's what people tell their kids. And so everyone believes America's a classless society, and it's not. That's one of the things, and classes I've taught and having to teach that class exists and about class. It's one of the things my students are just shocked by and fascinated by as we get into it, because they've seen it, they've lived it, but they've never had words for it. And here, higher classes tend to use race among the lower classes to keep them divided, because if you can keep poor black people mad at poor white people and vice versa, they're not going to get together to challenge the people that are
the real
pulling the
issues
strings that are
Yeah.
causing the issues, exactly.
Do you think that kind of individualistic American attitude is part of the reason why we don't see like more labor unions and more union strength in general?
In part, yes. Historically, Reagan really broke the unions in the 80s. So part of the lack of our union strength was the federal government, focused on busting the unions during Reagan's presidency, and that really hurt them. We're starting to hear there may be some comeback in building in. Union membership is slightly increasing nationwide. But no, and I also think a lack of class consciousness is why people don't think about unions or joining unions, because they don't understand the concept, and it's not really something that in many states
Is presented
or
as
even
openly.
presented as an opportunity.
Yeah. And speaking once again to that kind of divide between the individual and these massive corporate entities, there's this idea of social murder, originally coined in a paper in 1845 by German political scientist Friedrich Engels. What is social murder, and do you think it applies in the context of this murder?
Yeah. Social murder, Engels uses to refer to what sociologists today would call institutionalized discrimination, unequal treatment based on social structural systems. So he's talking about deaths from poverty. He's talking about deaths from disease because of lack of access to health care. So he's talking about all those secondary deaths that happen because of state malfeasance or state inaction. So when he's talking about that, he's talking about the people that are dying because of the behavior of institutions. Now, the way that concept comes in here is that United Healthcare could be seen as engaging in social murder because of the people that have suffered and died because of their denials, and they're one of the worst at claim denials in the country, which is why Thompson was targeted.
I think there was even, correct me if I'm wrong, but I believe they had started using AI to auto-deny.
They were using AI in their first round of claims denial, and that's just insane. And we've all experienced that. We've all experienced claims denial. I mean, both of my kids have special needs. My wife and I have spent 2 decades on the phone with insurance companies, getting them to do what they need to do. And so, yeah, America's really does not have a lot of sympathy for the insurance industry.
Yeah, and as you are probably very intimately familiar, I am as well. My brother had Duchenne's muscular dystrophy, so my dad having to call the insurance company 4 separate times to get them to cover a wheelchair.
Yeah.
It's like, why did I have to go through all of this stress and trouble to get this to work out?
Because they're hoping you will stop bothering and they will increase their profit margin because the shareholders are their only responsibility. That's hyper-capitalism. That's where we are.
And as we continue to see the fallout of not only the capitalist system, but the healthcare industry, and the fallout of more specifically the Bernie Sanders campaign back in 2016 and 2020, there has been more of an appetite for these more left-leaning progressive policies. And at least at the time being, the Democratic Party does not seem particularly responsive to that kind of change in messaging. Do you expect that to change anytime soon? Do you think the Democratic Party will relent in any kind of way?
Just like to jump back for a second and say that the actual killing of Thompson could be seen as retaliation for social murder in Engels' IVF. I forgot to mention that. No, the Democratic Party is absolutely feckless. They know they need the youth vote. They don't know how to get it. My whole life, the Democratic Party has failed upwards and downwards and have never been able to accomplish anything of significance. Now, neither are the Republicans, but you asked me about the Democrats, and no, and they're not interested in leftist ideas. AOC is the extreme of the Democratic Party, and
should be called a moderate in Europe.
I was about to say, that's about what it should be, a moderate in Europe. The Democrats would be center-right in Europe, but they are completely incapable. They don't have strong leadership, at least. We'll see. I mean, Pelosi stepped down so Jeffries could step in, but we haven't seen any messaging changes.
Yeah.
So, no.
Just kind of more of that status quo, and I think this election, especially like the one in 2016, has showed discontent with that status quo and not really a popularity of either party.
Exactly.
Like the Republicans are playing to their base, actually accomplishing some of the goals that they set out upon, but that doesn't necessarily make them very popular.
And they're working off a minority. I mean, you're really talking about 20% of Americans that voted for Trump.
And do you think this kind of desire to blow up the political system as it exists right now is kind of based in that discontent?
Among young people, absolutely. My daughter's 21. I talked to her quite a bit, and I've talked to a number of younger people. And if you look at the surveys too, there's a complete dissatisfaction with both parties and the representation people get. And people on the right and left don't feel their needs are being addressed in Washington. And so, yeah, people voted for Trump to blow things up. And people wanted Kamala to do the same thing and got behind her because they saw and hoped she would do similar change. They'd given up on Biden, which was one reason Democrats changed their candidate midstream.
So speaking to that discontent, do you think the response that has come out of the shooting is any type of indictment on not only the American government system, but American society and culture as a whole?
An indictment on our insurance system, an indictment on our compassion system, definitely.
Yeah. And it'll be interesting to see how these things continue to play out and change, if the healthcare landscape is going to change in any significant way going forward. Dr. Mullins, thank you so much for your time.
Oh, thank you for having me.
And for all of the crew here at WSIU, I am Ethan Neir. Thank you so much, and good night.